me tell you about a friend. It's Craig LeBlanc where the good times never end. Talking Parks and Rec, it's a show you gotta know. Welcome one and all to the Daily Parks and Rec Show. It's the Daily Parks and Rec Show.
Parks and Recreation is part of the reason I think it's essential is because it's not like other departments. We don't have to be the same department offering the same services from community to community. Because we are very different from community to community, that makes us able to do just about anything.
Welcome to the Daily Parks and Rec Show Leadership Series, where we highlight the voices shaping the future of our field. Today, we sit down with Jason Jones, a Parks and Rec professional whose journey weaves together leadership, health and wellness, and groundbreaking research. Jason has dedicated over 2 decades to building stronger, healthier communities. From directing local parks departments to partnering with Duke University on innovative programs like Fit Together, helping children combat obesity through recreation and community support. In this episode, Jason reveals how Parks and Recreation is more than just playgrounds and programs. It's about equity, prevention, and connection, serving seniors, supporting marginalized youth, and creating spaces where health and community thrive. If you've ever wondered how Parks and Rec professionals can transform lives at the intersection of wellness and research, this conversation is for you. Let's dive in. All right, we are live again with the Daily Parks and Rec Show. This is Craig LeBlanc, the doorman, with another great leadership series. Jason, we were supposed to meet yesterday, but as always, there's always technical issues when you're making live content and stuff. So just expect it. If you don't have a technical issue, it's like 1 in 10. The other 9 will have something going on. So luckily, I had an open slot and he was open, so we're able to do his interview today. But how are you doing today, Jason?
I'm doing well, Craig. It's great to see you.
Yeah. What we're going to do is we have a commercial that we made for all of Parks and Recs. This is a gift from us to you after doing 247 live interviews, over 500 phone call interviews. We've gotten really good at understanding the stories and the issues that Parks and Rec faces. And so we created a 2-minute explainer as why Parks and Rec is an essential service, knowing that many of you are fighting desperately for tax dollars not to get cut away from Parks and Recreation because the elected officials don't see Parks and Rec as an essential service. It's something that we can get rid of in tough times. And so we made a commercial that actually pushes back. It's on our YouTube channel, not copyrighted. Anyone and everyone can use it, blow this thing up, and let people know that you are working in an absolute essential service. So I'll go ahead and play this, and then we'll come right back and talk with Jason. When we talk about essential services, what comes to mind? Police, firefighters, healthcare. But there's another essential service, often overlooked, yet always present. Parks and recreation. Parks and Rec is health. It's the walking trail that lowers blood pressure, the recreation center where seniors fight isolation, the swim lessons that prevent tragedy before it happens. This isn't a luxury, it's a lifeline. Parks and Rec is safety, a playground instead of a street corner, a basketball court instead of trouble, a summer camp where every child belongs. It's not just about activity. It's about protection, prevention, and possibility. Parks and Rec is community, the festival that brings neighbors together, the cultural event that teaches respect and diversity, the open space where a city breathes. It builds bridges where division once stood. It gives people a reason to gather, to connect, to care. And Parks and Rec is economics. It strengthens property values. It drives tourism through events and trails. It saves on healthcare costs. Every dollar invested multiplies, feeding back into schools, into safety, into growth. Essential service is not just about survival, it's about thriving. And Parks and Recreation is where thriving begins. In wellness, in equity, in culture, and in joy. Parks and Rec isn't extra, it's essential. For our health, for our safety, for our communities, for our future. A message from the Parks and Recreation community. All right, so how do we do on our little creation there, Jason?
Man, you absolutely nailed that. I mean, I got goosebumps. Some of the things that are going through my head for our conversation today, that prefaced it really, really well.
Yes.
And I think one of the things that I want to say, and I just want to share with you, I appreciate as a Parks and Recreation professional, you being here every day, putting commercials like that together, talking about the importance of Parks and Recreation in communities, because Parks and Recreation people are oftentimes they're the quiet leaders behind the scenes. They're the people
Mhm.
that aren't seen as often. And so having you out here every day pumping the tires of our Parks and Recreation professionals across the United States is amazing. So Craig, thank you for what you do, as well as commercials and putting that message out there, because
Yeah.
it is absolutely essential.
Well, I'd like for people to think of the Daily Parks and Rec Show and DPR's media company as we are almost like those talented artists in your community for hire. And yes, we'll paint something for the trucking company, but man, we'd love to create for things that make a difference and have an impact. And now that we can full time create for an industry that we see the work they're doing, and we're not producing any type of commercial value where we just get a paycheck and don't make a difference. Our videographers and our content creators, they get paid to paint in their art form for this industry, and they absolutely love it. Like they I wish y'all could see the communication in the back, and kinda in the back of the kitchen, and the excitement they have to create for this industry. So we're definitely gonna keep doing it because we love
Yeah.
representing y'all and helping y'all to tell y'all's story. And you're right, these are some silent leaders that don't like to be in the limelight. It's hard to get many of you on stage to just tell your story, but when y'all do, it's so powerful. And so we love helping y'all in any way that we can.
I tell you what, one of the things that I absolutely love about our industry, and it's such a challenge because our department, our industry, the Parks and Recreation, we are departments of intimacy.
Mhm.
And it's not too often the most intimate parts of you that you're willing to talk about, expose. The things that happen inside our facilities, inside our parks, we are truly a department of intimacy. If we're a municipal departments, I hope nobody's getting intimate in your streets or on sidewalks or in your water system. But in Parks and Recreation, very physically, we have people that are exposing their bodies in our locker rooms, getting ready for whatever activity they're taking on. They're teaching their kids to ride their bikes for the first time. So that first time, mom or dad lets go of a seat, that is an intimate moment with their kids that they hold so deep to them. They're not willing to always talk about.
Mhm.
And I think a lot of Parks and Recreation professionals that do what we do know that they are kind of sometimes the gatekeepers of those secrets. They
Mm.
know the people who are there swimming that are rehabbing a heart attack. They know that, Craig had his kid learn how to ride a bike at this one park. And that's something that's special to them. So as Parks and Recreation professionals, we know that um, we have to maintain some privacy. We can't go out and say, hey, city manager, Craig LeBlanc taught his kid how to ride his bike. He yelled at him 4 times, but by the
Right.
time that kid got on, you should have seen how much they hugged. You should
Yeah.
have seen the interaction. And that is one of the most beautiful things about what we do, but it also makes it really hard to talk about on those stages. I
Mm.
think we can talk about it as an industry, but would someone from another industry want to hear about that? And I think that's what makes it tough. And so I think the work you're doing is great.
Yeah, and if we can stay on this topic a little, if when we think about the marginalized parts of our community, and so I'm thinking of the elderly people who are now alone, and a lot of their friends and family have just died because they're getting old.
Hmm.
And in Parks and Rec, we have these senior centers where the seniors can come together and find community and connection, and the community centers, the Parks and Rec departments facilitate that. And then we also have marginalized children that can't afford to be on these elite teams. So the only thing they can afford to do is something that the municipal government pays to orchestrate these leagues, these community leagues that accept all children at all athletic levels and are able to keep the price so far down that almost anybody can participate. And many of them offer scholarships for those that financially couldn't afford to participate. And then you can
Hmm.
just go down the list of how um, these are caring for people who just are not at a point in their life. And as you look down the road, many of those people come back and are now Park and Rec directors because they grew up in Parks and Rec because it was their family, it was their home. And
Yeah.
shout out to Gabby Vera, who is a great example of that. I don't know if you know her, but she is just a force to be reckoned with. But she was the 4-year-old in the after school care that looked up at the director and said, "I'm gonna have your job one day," and she did.
Mhm. Yeah,
So,
I was a assistant director or director of Parks and Recreation. I've been both for 20 some over 20 years.
mhm,
And there was always like a special spot in my heart. So I've interviewed a lot of people, for jobs. And to hear the people, I would always ask the question, and it's a cliche question, why are you going into Parks and Recreation, or why do you do what you do? And there was always like a special spot in my heart when someone would say one of two things. Either one, I was a Parks and Rec kid. And the thing is, they always said it like that. They were never like I was a child raised in the Parks and Rec department. It was always, I was a Parks and Rec kid.
mhm,
And those people that move on are astounding to me. And those are people that understand why we do what we
mhm.
do. The
Yeah,
other answer that I always love is people are like, I felt this calling into doing this, and it's that intrinsic drive that those people feel to give back to their community, or to have seen when they were younger. I saw somebody do this for me. I need to do that for someone else. That I think that captures the essence of servant leadership that really drives much of our industry.
yeah,
And the video that you showed, or the commercial you showed a second ago, and I don't want to like spend all of our time on that, but it talked about community, and you just mentioned it, for our mature adults who may have just lost a loved one, or marginalized people in our communities, people that are trying to find their place. One of the things in the commercial mentioned community, and Parks and Recreation is part of the reason I think it's essential, is because it's not like other departments. You could go from the city. I'm in Durham, North Carolina. Town of Chapel Hill, their Parks and Rec department is a little bit different. They offer slightly different services. Durham
mhm,
does it a little bit differently. Raleigh does it a little differently. Wake County does it differently. How Los Angeles provides Parks and Recreation is very different than the way Grand Traverse County, Michigan does.
mhm,
And we are unlike fire, police, water, sewer, transportation, because we're not like anything. We don't have to be the same department offering the same services from community to community. And because we don't have to be the same everywhere, that means we can do anything anywhere. And
right,
so being able to say, all right, our mature adults, they just had, a leader in their community, maybe a senior center closed down. How do we bring that community in? A lot of the work I do is with kids that have been diagnosed with obesity. Bringing them in and helping them create a community around health and wellness is part of what I now do as a Parks and Recreation professional. So
mm,
because we are very different from community to community, that makes us able to do just about anything.
yeah. Yeah, and it does because every community is different. I've interviewed people that are in the Dallas and Austin, Texas markets that have money just coming out of the sidewalk, and I've interviewed people that are, I mean, for lack of a better term, their community is the ghetto, and
Mhm.
that is who they have to serve, and they serve them differently than the Texas communities or the communities up in Illinois or the communities down south or communities up
Right.
in New York, and Parks and Rec has that flexibility to go serve to meet people where they're at versus just having like a fire department. I would imagine all fire departments are nearly carbon copies of themselves, minus vegetation and stuff. But for the most part, they're
Sure.
very, very similar. Whereas Parks and Rec can almost morph into what the community needs versus saying you have to meet us. They can go out and meet the community where they're at.
Yeah, there was this. I would love to take credit for this, and I'm going to probably not get it exactly right. But there was this documentary called "The Weight of the Nation," which came out years and years ago. And when they do their intro to the documentary, there's a gentleman that comes on. I don't know what his name is, but this has stuck in my head. the The reason for local government is to utilize community resources to solve community problems
Mm,
that individuals can't do themselves. So thinking about, if an issue in your community is homelessness or, you know, reliable food systems, Parks and Recreation are one of the only departments that you could actually say, all right, we need a few more resources, but this is something we can do. We have the Parks and Recreation infrastructure in our community, whether it's a park, a playground, a community center, or whatever it is. Let us have those additional resources because we can do that, whatever it is. It's one of the unique places that municipalities can do that. And that's one of the things that I absolutely love about what we do.
yeah. I'm calling it right now. This is going to be a two-part series. There's no way we're doing this in an hour.
I'll try and stick to questions. I'll try and stick to
Yeah.
questions.
No, because it's almost like when I get people like you that have just a deep understanding of Parks and Rec and have dedicated so much of their life to it and are very articulate at describing the story, the problems, the opportunities in Parks and Rec. It's like, we're not rushing this. We 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 need to record 24/7 round the clock and create content, and so we have the bandwidth, so I don't feel rushed at all. We'll
Okay.
do a part 2 for this. And also, I wanna play in our halfway break, we created another one, which was our first one, which is why you should consider Parks and Rec as a potential career if you haven't decided yet, and unfortunately, most people don't even I can't tell you how many times I've heard, "I had no idea you could even get a job in Parks and Rec," from people.
I'm one of those people that would tell you that. Like,
Yeah.
I would have my 1999, 2000 self would have said that.
Yep. Yep. So let's go ahead and because I noticed in our commercial we talked a lot about health and wellness and how if we think hospitals and healthcare is an essential service, I don't think people have. Matter of fact, I know people don't understand at your level how Parks and Rec plays in the preventative maintenance that healthcare is. And what is that old saying? I think by some Greeks that said an ounce of prevention is worth a pound of cure.
Right.
That that Parks and Rec is that ounce of prevention inside the community addressing health issues. So maybe we can start the conversation there.
Yeah. So, it's interesting. I'm preparing right now to go to present at NRPA next week, and was just thinking through, and I'm going to actually talk about how Parks and Recreation departments can partner with their local pediatricians,
Mhm.
because creating that type of relationship allows Parks and Recreation to be utilized the right way based on the local context for health.
Mm,
And so as I was thinking about that, I was like, why does Parks and Recreation do so much with healthy youth? But we do it because that's what we were founded on. Some of our foundational institutes in our industry were there to help kids be healthy.
mm,
It was the creation of Central Park, to give people that were moving in mass to New York City, give them some place to play, give them some place to recreate. It was the creation of Boston Commons in like the 1600s. Places to come together, places to congregate, places to be community, and then like the creation of Hull House in Chicago. Let's find a place inside where kids can be healthy.
Mm.
And so from the start, we talked about how can we utilize our collective resources to make our kids healthier. And it's really interesting. I think at some point I don't want to say that our industry has forgotten about that, but we don't talk about how it's coming back now. And so the work I do, if someone were to say to me, like, Jason, what is it you do? I don't know. What is my job title? I couldn't tell you other than being a founder and principal. I can't say that I'm a researcher because I'm not your mad scientist, prototypical researcher. I'm the person who understands enough about science to say, all right, this is what the science says, and this is how we can bring community resources together to find that happy place. And so one of the things that I do right now, I'm working with Duke University to disseminate and commercialize a program called Fit Together. And it's a really interesting program that creates a partnership between a local parks and recreation provider and a pediatrician's office. And so we have a whole curriculum that allows the doctor's office to refer a patient to the Fit Together program. So if a child comes in the case here in Durham, and the child's in the 95th percentile for obesity, and they have no other health concerns related to physical activity, they're prescribed to go to this recreation center, one of Durham Parks and Recreation's recreation centers, and they create a community of other kids who look like them, participate like them, have a lot of the same concerns. And so one of the pieces of feedback we often get from our participants is that I like coming here because the other kids look like me. And so we have these amazing folks that engage kids throughout the course of the Fit Together program and get them physically active. And what we've found is that over the course in the work that we've done, as well as work that other researchers across the world have done, is we've found that 26 hours of treatment time, so doctor's visits and physical activity and nutrition, so nutrition education, when I say nutrition, if we can put those things together for 26 hours of a child's life, they will have a decrease in BMI. In most instances, of course, a decrease in BMI, higher cardiovascular, better cardiovascular health, and they'll have a higher quality of life. And that's something that those 26 hours over the course of like 3 to 12 months, those will maintain and stay with that child and give them a new lease on life. It is truly, we are, recreation is called recreation because it's to recreate. And so we're helping to recreate these kids with a different opportunity than they would have had before that 26 hours of treatment time.
Yeah, and I probably should have done a better job of, it's almost like I want to go back to the beginning of the show and introduce you a little bit better. But, oftentimes when we're facing a problem, it's at the intersection of a couple different disciplines. And so you come from Parks and Rec, health and wellness, and research, where these three things intersect. And so I would say that you are either there or becoming an expert, already pretty much an expert in running a Parks and Rec department, because you have decades of experience as a director. So you understand that at a very granular level. But then the topic you've chosen to really dedicate your life to is the health and wellness part, which is another medical health and wellness, fitness, diet, that kind of stuff. And then it would be great if we could also find somebody that wanted to do some research on that. And this is the person you're speaking to, Jason. Is somewhere.
Yeah, that's where I find myself these days.
Right. So are there any gaps maybe to fill, as far as maybe speak a few minutes at least on how are you an expert in Parks and Rec, directors, the problems they face? How are you an expert in healthcare and wellness and dietary and that kind of stuff? And then how have you started your, I think you've kind of most recently of all those started your journey on research and becoming somewhat of a researcher. Is there anything you'd like to touch on each of those three disciplines?
Yeah, yeah, because I need to ratchet down what you've just identified me as in all of those categories.
Right. Well, so
So,
people kind of know who the authority is in front of them, and then
sure,
I
sure.
think your message will have more power because 'cause they're like, "Oh gosh, he's an expert in all 3 of those disciplines."
Yeah, I think my story, this is actually a really interesting, because what is today, the 12th? Yeah. This is a really interesting day for me in thinking about, like, where did I get started in doing what I'm doing? And I know this is my origin story, I guess, if you will, for Parks and Recreation is I was a Parks and Rec kid, but I didn't know that at the time. And so I was able to I wanted to be far enough away from home for college, um, that I couldn't be home every day, but I could get home if I wanted to. So I went to Central Michigan University, um, which at the time, of course, I wasn't thinking Parks and Recreation. I was going to go into pre-optometry. And so over the course of 5 years, including a study abroad semester, I had decided to be a triple major: geography, earth science, and social science. And a friend of mine told me that she had just signed her major and she was going into Parks and Recreation. And I laughed and I said, "What are you going to do? Be a park ranger for the rest of your life?"
Yep.
And so I scoffed at it, but this was while I was traveling abroad in Australia, and while I was there, I went to the second oldest national park in the world, Royal National Park. I also did some hiking, which prior to studying abroad, I didn't go outside. I didn't do any of that fun stuff. I hadn't done a lot of travel. And so I got done studying abroad and I was like, man, I've just been to these two amazing national parks in Australia. I visited the Great Barrier Reef, and I was like, I haven't seen any of the United States. And that's when I fell in love with the national park system and um, thought, do I want to be a map maker? Am I going to be the next Rand McNally?
Mhm.
And I'm so glad I didn't choose this, because if I had have chosen to make atlases and maps in 2001 when I graduated as a triple major, I wouldn't have been in business now.
Right. Yeah, iPhones kinda gobbled that one up.
Oh yeah, 100%, 100%. And so I was like, man, what am I going to do with my life? I want to go into Parks and Recreation. I want to be the next director of Yellowstone. So
Wow.
that was my goal. And fortunately for me, I was at an amazing place for Parks and Recreation at Central Michigan University. And I got into grad school and I was like, I don't know what I want to do, but I'll go into Parks and Recreation. And this was 2001. And I got into the program and had to talk with my advisors, and the chair of the department at the time is a guy named Roger Coles, an amazingly brilliant man. He and I worked together and put together my advisory panel, and he was like, I'm going to put this super analytical person on your panel because you need that for your grad work. You need to really get into the research and understanding how to do research and statistics. And I looked at Roger and I said, Roger, I am getting a degree in Parks and Recreation because it doesn't make sense for me to change my major again. And I'm never, ever going to do research. I'm never going to use this
Oh,
degree
you're tempting
to do
fate there.
research. I said that, those words came out, and I think he laughed at me. And so I started my uh, work in Parks and Recreation, and I studied abroad, or excuse me, I did the first year of work. I went to work for the National Park Service in between year one and year two. And I was like, this bureaucracy is too much. I'll never get anything done. It's going to drive me crazy. So going into my second year of school, I had a grad school. I was like, I gotta rethink, I gotta rethink this. And a friend of mine turned me on to community parks and recreation. And I'll never forget it. On September 11th, so yesterday was September 11th, 2025. On September 11th, 2001, I was supposed to go to my first meeting as a student for the Michigan Recreation and Park Association, but it was canceled for obvious reasons. And so
Mm.
September 11th is actually like kind of etched into my brain as that was 2001 is when my Parks and Recreation journey really began formally.
Wow.
The year prior was amazing, a lot of basics related to grad school and stuff like that. But then the second year was more, okay, I'm going to focus on community. I really liked the idea of being a Parks and Recreation person that was giving back to my local community. It's one thing to be the director of Yellowstone, but to be the director of Battle Creek Parks and Recreation, which is where I was from, or to be the director of Traverse City, Michigan, or Grand Traverse County, I knew that I could make an impact there. And so that's what I did. Ended up getting my
I have a question for you around
yeah.
that, and I don't think a lot of people identify this that are outside of Parks and Rec, but when I ask, "Why are you in Parks and Rec?" to so many people, the answer has often come around to, "I get to build community." So, what does that mean to you? Like, can you describe that to someone that's not familiar with Parks and Rec about, no, you actually are getting to build the the group of people into a community?
So I accidentally learned this by having a degree in geography, earth science, and social science is an amazing preface to a degree in Parks and Recreation. So the idea and the concepts associated with community and what brings people together, demographics, how does the landscape, impact how we act as a species is something something that I knew from undergrad, but then in grad school, and then my first couple jobs out of college, that's when it was really solidified for me.
Mm,
Being able to figure out what are we trying to do here? Are we trying to teach a 5-year-old how to play baseball? You can create that community for that 5-year-old. He's probably not going to be in the MLB,
mhm,
but can you create a group of 5-year-olds who love baseball? Or can you create a group of 5-year-olds that love being on a team and creating the community around that?
mm,
That is a way to get a kid physically active and improve your community kid by kid starting at 5.
mhm,
Is it the kids with disabilities? I was in Michigan. So in Michigan, you have to learn to swim because you could literally, I don't want to stereotype Michigan, but you could crash into a lake and have to get yourself out. Like, this is the thing. Like, living in North
right,
Carolina now, I'm like, there's no water around here, but in Michigan it could happen. I can think of like this one curve and then where I used to live. Anyway, what do we do for kids who live in a watery place that don't know how to swim?
mm,
And so later when I was in Grand Traverse County, we had a program that was amazing. And I didn't realize when I started how much community was created around teaching kids with special needs how to be water safe.
mm,
Creating the opportunity for the mature adults to rehab themselves and come in. That was a community. The little old ladies that did water exercise, the exercise was maybe half of why they were there. It was the socialization that happened in the locker room or when they went to coffee after. And,
yeah,
and so oftentimes, and then later when I was with Durham, it was interesting because all of a sudden I went from this community. I was in Grand Traverse County, so like 90,000 people in the whole county, to a city of almost 300,000. And there, it really made it evident how place and how specific parks can pull a community that's very, very diverse together around their sport or their activity or around a pavilion. And so yeah, creating community is the thing that I love the most. And
wow,
like you mentioned, the folks that do your AV stuff that love doing AV stuff, they just get to do it for Parks and Recreation. That's how I feel. I get to create communities in Parks and Recreation. I just happen to love both.
right, I
And
love
very much so. That's what drives me.
I knew this was gonna happen because it's like, I feel like we're still somehow oddly still in the introduction, and we're already at the 32-minute mark. But I wanna play this other commercial. This is gonna, it's not really a commercial, it's another short film, we like to call them, for the Parks and Rec industry as to why you should consider Parks and Recreation as a career path. And the why behind this is there are not enough internship programs for Parks and Rec, that Parks and Rec departments are running. There are not enough college professors and universities that are teaching the curriculum for Parks and Recreation, and enough people. This is what I think we're still, yeah, we're still classified as a discovery major, meaning you figure out that this is even a thing to do later in life or after you're already in college. And so our thought process behind creating this was, let's create a short film that helps plant the seed and start the conversation to some Parks and Rec professional that finds himself in front of staff that are part-timers, lifeguards, concession stand workers, or maybe they're speaking in front of a college class. This is what you play for them, and then you can take it from there. So we'll play this and we'll come right back. I know this is going to spur a lot of conversation between us. So, and let us know how we did on this one as well.
All right, I will.
Every career is a choice, but few careers let you touch lives. Not once in a while, but every single day. Step into a park on a Saturday morning. You'll hear children laughing on the soccer field, families gathering for a picnic, seniors walking the trails, finding health and friendship. And behind every smile, every memory is a Parks and Rec professional. We don't just mow fields, we grow confidence in young athletes. We don't just build playgrounds, we create safe spaces where childhood thrives. We don't just plan events, we design moments that anchor generations. Think of the coach who teaches patience, the director who champions equity, the staff member who sees potential in a child no one else believed in. Every day, Parks and Rec professionals shape character, preserve beauty, and strengthen community. And the path isn't easy. Budgets are tight, resources stretched thin, but the reward, unmatched. Because what you give comes back in legacy, in healthier communities, in lives forever changed. So why dedicate your life to Parks and Recreation? Because here, your work never ends. It lives on, in laughter echoing across playgrounds, in green spaces preserved for the next century, in the young professionals rising to lead tomorrow. This is not just a career, it's a calling, it's a legacy, it's Parks and Recreation. A message from the Parks and Rec community.
How we do on that one?
You're crushing these, man. You're crushing these.
Not me. I'm the figurehead up front. These designers are just so gifted and talented, and they get excited when they walk through the door with their canvas and their paints, and they get to see what they get to paint, and they're like, oh, they love it. So
Well,
hats
send
off.
them my love. Send them my love and thanks because they did an amazing job nailing that.
Yeah. Well, they're watching this live. They watch all of our lives, the entire team, and then because they have to go back and edit this very recording and prepare it for mass distribution, and that's why they're so knowledgeable around. We've got developers that are more knowledgeable about Parks and Rec probably than anyone on earth because this is what they do 8 to 10 hours a day.
Yeah. I think you nailed it. One of the things that kind of an offshoot of that, one of the things that we've worked on before, I had an amazing colleague when I was in Durham, a guy named Jeff Ford. And Jeff has an amazing passion for teens in our community. And he developed this program called My Durham, and it was essentially a free program for teens between the hours of between after school and 5 o'clock. So that weird time that it's hard to the program for in a recreation center. But he and I always talked about creating a program that gives kids hope. Like, I don't care what you do, Jeff, as long as it's safe and, it's within, city policy. But what we want to do is inspire hope. And one of the things that he and I talked about a lot is, career development for kids. And I think what I know, one of the things that he and I always talked about, we have kids that come out and they're like, I want to be a professional basketball player. I want to be a professional football player. I want to be a professional sports this. I want to be a professional sports that. And one of the things that I think is amazingly underrated is most people aren't going to make pro sports, but going into parks and recreation puts you adjacent to it.
Mm.
And if you're a true sports fan, for me, my passion is ice hockey. I grew up playing it. I coach my son now. I worked at an ice arena. So, to understand the difference between 19-degree ice and 16-degree ice and who's skating on each of those things is something that I understand. I know how a Zamboni works. I knew I was not going to ever play NHL. I knew I was never going to play college, although I do have 4 years of eligibility left. I want to say that. Um,
Not too late.
but I was driving the Zamboni. I was the guy that was making sure our university team was on the ice at the right time. I'm the guy now who's standing behind the scenes. I'm not rubbing elbows with, you know, Rod Brindamore or anything at the Lenovo Center for the Canes, but I'm backstage putting kids on the ice between periods, which if I had have gone into Parks and Recreation because I wanted to be adjacent to sports, I would have had a successful career right now and been done with it.
Mm.
And so identifying and being close to sports, being close to understanding the science of sports, just the idea of I want to be such a good turf field scientist that I make the NFL because I work in the stadium.
Mm.
That's a powerful thing. Where else do you get that? Sure, you can go to turf science programs. NC State, I think, has one, but going into Parks and Recreation, you could do that. And so there's all of these amazingly adjacency. There's a lot of adjacency with Parks and Recreation to so many things that create opportunities. And if a young person is saying, I want to do this, but I know I'm not going to make the NHL, how do I drive a Zamboni and make a career of that? Parks and Recreation.
Yeah. Yeah, and maybe you can even speak on that a little bit more about how Parks and Rec is not just about what what might first come to mind as an industry, but this industry needs everything. It's such a massive. I think last I heard it's approaching a $250 billion industry, but it's managing I think by our math, close to $10 trillion with a T worth of real estate. The real estate portfolio of Parks and Rec, all the community centers, swimming pools, park, green spaces. It's a massive infrastructure project that's being maintained and built and stuff. But maybe talk about all the other different disciplines that are necessary from accounting. I mean, you name it, that Parks and Rec needs to deliver the service that they're delivering.
You know, that's a great question. I think I can slide into an answer there. One of the things that I'm working on right now, and this is where I'm kind of falling into, research and recreation. One of the things that I'm working on, and I'm working with a researcher at NC State, Dr. Aaron Hipp, and actually, interestingly enough, an epidemiologist at Duke, Dr. Emily D'Agostino, and we are trying to figure out how can we get more research evidence into
Mm.
the decision making minds and justifications of parks and recreation professionals. And it's been interesting because we've been trying to figure it out. I want to figure it out specifically for my program Fit Together that I'm working with Duke on. But as Emily, Aaron, and I started talking about this, it was like how we would get research evidence in for transportation in trail design is very different than how we would get research evidence in front of folks um, for obesity treatment, or how we would get treatments and research evidence in front of a director or in front of a mayor for treating anxiety. And so I think I'm kind of going off. I'm spinning off on a tangent, but the idea of understanding what Parks and Recreation needs is a really tough thing to do because, like we said at the beginning, Parks and Recreation from community to community is very different. And so for us, and I think that's a difficulty for us as an industry to narrow down. All right, guys, these are the 17 things that Parks and Recreation needs to understand because we do it all. We can't have a container of things we need to know. We need to know it all, and we need to
Right.
know it. And what makes it even more difficult, like I want to understand, the latest and greatest from the World Leisure Association. That's great,
Mm.
but how do you translate what the World Leisure Association has identified and make that applicable to, East Durham?
Mm.
Being able to translate that is really difficult. And it's not a one size fits all things. We have to be specialists in Parks and Recreation and understanding what is the problem we're trying to solve? What are we trying to make better? And then trying to figure out, and this is one of the things that I've really been pushing for. How do we make it easier to understand, quicker to understand? Because one of the things that I've learned over the past 18 months since I started my business is, do you know how long it takes to really read and understand a journal article? I didn't have time as a Parks and
Yeah.
Rec professional. It would to understand it, kind of to understand it and then contextualize it. That would have taken me a full day. A 16-page article. And so one of the things that I'm working with some colleagues on is trying to understand how can we translate the big research ideas into usable and applicable things for local community or local decision makers. So I think
Yeah.
that kind of answered your question.
No, no, that's it. That's it. And if anything, I wanted to highlight how there's so many disciplines that we need depth in, and then the application layer is is so broad. And when we say what is Parks and Rec, what is a community, and a great example that I've stumbled across while creating the Daily Parks and Rec show was urban forestry. I had no idea that even existed inside of Parks and Rec. But then you open up the whole field of master arborists and tree surgeons and the public land and the trees and the heat maps and all that stuff. And it just blew open a whole nother part of Parks and Rec. And knowing that no amount of decades of experience running aquatic centers is going to prepare you to manage the tree inventory that a master arborist would, but they're all under
Right.
Parks and Rec. It's all
Yep.
part of the service that Parks and Rec delivers.
Yeah, and then if you're in an older community, you have to be thinking about how that tree canopy is distributed. Is there an inequitable distribution of that tree canopy? How is that negatively creating the urban heat island around your downtown area? And what does that do for people that what does that do for your homeless population? How does that impact their health and wellness? How does it impact
Mhm.
how does that impact that tree canopy impact how many days a year a young person can get out and be physically active. Living
Yeah,
living in the South, there are days that I don't want my kids to go out and play because it's too hot. And it's
right.
it's dangerous. Let alone the guys who are out, mowing and weed whipping our parks.
Yeah.
Yeah,
Yeah,
I
and
mean
then
that's a whole different area.
my community here, I'm right outside of LSU campus, and you can run a 5-mile loop around the LSU lakes, and the entire loop is nearly shaded by these gorgeous oak trees, and you just would not want to run that during the summers, but because it's all shaded, it's never ending year round, and
Right,
so it's how tree canopies and urban forestry and master arborists meet health and wellness and running and cardio exercise and stuff, and they kind of
right.
collaborate together to create a healthy individual that can go running on a hot summer day around LSU campus. Otherwise, like you said, in South Louisiana, you don't want to be outside in the summer if not.
Right, right.
Yeah. Um, so we have enough time maybe for a couple more questions. So think what are maybe the one or two more topics we want to cover, and then we'll save everything else for our part two. And I think I think I have you scheduled for the NRPA convention, right?
Yeah, I'll
Are
be
you
there. I can't remember exactly what time, but I know I'm
Yeah.
following. I'm kind of excited about this. A gentleman who I've never met before, but is the director of Chapel Hill Parks and Recreation, which I live about there. I mean, they're
Atoya.
an adjacent community. Atuya, yep,
Yeah.
yep. So I'm
Oh,
hoping
yeah.
to get there a little bit early, and maybe the three of us could talk.
Oh, yeah. Yeah, we could do that. And then we may want to do like a 2 or 3-part series because I really want to go deep on your research and health and wellness. But maybe you can just give us just a 50,000-foot view of your research and health and wellness and how that ties into child obesity and stuff. A little teaser there.
Yeah, so I was thinking about, how would I tell this whole story in a connected manner, if you were to ask a question like this today. So um, I do want to say this. I am a researcher because of the folks that I'm around.
Mm,
Late in my career at the city of Durham, I was there for almost 10 years. The thing that excited me the most about Parks and Recreation is understanding what are we doing to make our community healthier. And so for the 10 years that I was in Durham, I helped some folks, Dr. Sarah Armstrong and Dr. Ashley Skinner and Dr. Cody Nesterhook, with a program that we ultimately called Fit Together. And it was a community clinic partnership where kids that are diagnosed with overweight or obesity here in Durham and if they go to Duke Health, um, are referred to a place called the Healthy Lifestyles Clinic, where they deal with just kids that are obese and overweight. And so even before I started with Durham, they said, "Hey, we want to figure out how we can partner together with Parks and Recreation." And so the leaders before me started this program with Duke. And when I came aboard, it was something that I didn't realize I had actually asked for in when I was in Michigan, but after moving here, it kind of fell into my lap, and we really created a great relationship between Parks and Recreation and Duke. And so through the years, like I said, when I started Parks and Recreation, I wasn't doing research. I
mhm,
didn't want to. And so the thing that is kind of like pieced research together in Parks and Recreation for me is the iterative process of research. And so I don't know that many people know this, but I see it now. Now I see it daily where it's like research really starts. It's like research is kind of like your 5-year-old. You know how you have a 5-year-old and they're like, why? And you tell them, and then they're like, why? And then you
mhm,
tell them, and it's this ongoing conversation that you have with your your toddler or your young one, your infant, and it's like, what is the next question? So what really kind of got me going with this is we had this project Fit Together, which is our community clinic partnership, and that was kind of like it turned out to be this like big umbrella project, and it started with this question of if we were to and it's really kind of started with Duke. They said if we were to have kids go to a recreation center in addition to, so this was started by researchers. If we had them go to a recreation center in addition to coming to our office and be treated, will they be healthier after 6 months? And so, super simple question, a question that a lot of Parks and Rec people maybe haven't verbalized, but have probably thought, if I did this, would this happen? And so from 20 that started in 2012. Finally in 2016, there was this like sub project called Bull City Healthy and Fit. And so the question for that one was, okay, we've seen kids improve and get healthier, but now we want to actually test if we compare these two things. Kids that, you hear about this, like you have your control group, the kids who have always gone to the doctor's office and that's it. And then you have your experimental group, the kids who are going to the doctor's office and the recreation center. And so the second study was Bull City Healthy and Fit, and it showed that kids that went to the recreation center, their physical activity was higher, and they were
mhm,
healthier. So it was like in the super basic researcher in me, and this is kind of what I always go back to, is the first answer was yes, that did something. So
mm.
let's get a little deeper. And so then the second thing that we asked, that the researchers asked, and this is something I got more heavily involved in this, kind of at this point, where they said, all right, we do this in Durham. Can we do this in other communities? Is it feasible for us to replicate this in other places? And that was this study called Arches. And it was interesting because we went, myself and my colleagues from Duke, I was doing some moonlighting, I did some moonlighting with them. So did some work with them off of city time. And we drove all over the countryside of North Carolina. We had 8 different communities of different sizes, different demographics, different hospital systems. And we were able to recreate the Fit Together program in 8 of those 8 communities. And so we had a town of like 1,500 people, which this is crazy. And the people that are watching this will get it. We had a town of like 1,500 people, and they had a privately owned community center, which that's crazy to think about, but a privately owned community center. And we had an amazingly successful program. As a side note, the person who ran the program for us there has now just gotten that was in like 2018, 2019. The person that was running that program just wrapped up her doctorate at Duke. So it was
Wow.
this doctor, Isa Granados, cool lady. She's in Florida now. So we had that Arches program. And what we found is we could recreate this in other communities, and those kids are getting healthier too. So it was like we had 2 yeses. And so then the next thing was, okay, now let's get a little more technical. And we started asking the question, all right, if we take this little Fit Together program, bump it up, make it a little more professional, if we put that together, can we specifically decrease the BMI of kids that are coming to the doctor's office? And so we did that, and that was called the Hearts and Parks. And so Hearts and Parks, research takes forever. I mean, it started in 2018, and we're still writing papers about the data and what the findings are. So, I mean, here we are, 7 years later. See, this is why I didn't go into research. I'm not a mathematician.
Yeah.
8 years later, we're still writing papers with this. And so what the Hearts and Parks study did is it gave us something that we could jump into that the researchers could jump into the medical world and say, yes, we have a way to decrease BMI for these participants. And it has to involve Parks and Recreation. And so that's where we're at with the Fit Together program now. And we've reached a point where we're trying to disseminate. And so we got a grant through the National Institutes for Health. We're in the final year of that. And so we're looking for new communities that want to start the Fit Together program. And we offer guidance and technical assistance to get it rolling. And then we're going to move into commercialization. So we know that this works, and we've created some relationships and some partnerships with organizations like the American Academy of Pediatrics. In fact, I'm going to be presenting with them, as well as the CDC. And it's really it's one of the studies nationally that's led to the development of intensive health, behavior, and lifestyle treatments, which is an idea that 26 hours of treatment for a child with obesity that's overweight or obesity, over the course of a really weird timeline, 3 to 12 months, they will have lifelong improvements in their health by being a participant in this program. And so that's the big project that I work on. There are two or three other smaller, or I don't want to say smaller projects because they're amazingly impactful. One related to youth mental health and how can we utilize Parks and Recreation to bring down anxiety levels. And we've seen some amazing results there. Also worked with an epidemiologist at Duke about how do we reduce the transportation barriers for teens to get to Parks and Recreation services. And so we have a lot of data associated with that. And then this one that's really kind of out there, and this is one that scares a lot of people to talk about, because as soon as I say this, people are going to be like, oh, that's a violation of HIPAA. Because it was like this amazingly misunderstood thing as far as municipalities are concerned. But one of the things when we're trying to study and we're trying to understand communities and community health is we don't have all the data. You think about, like, you go to the doctor and they type everything in their little computer that's mounted to the wall, and they tell you this is where, if you have a kid, this is where your kid is on the growth chart. Well, that's all protected. That's all stuff. And that's a great snapshot of how you're doing right now. That's your test. They don't ever talk about the homework that gets you to the test. There's no way to connect parks and recreation. Is this kid participating in soccer? Is this woman who has arthritis? Is she going to the swimming pool? Is she going to the swimming pool for water exercise? And so there was this other project called CODI, the Clinical and Community Data Initiative, that I worked with CDC and a few other partners. We worked on that, and that's really amazing because it took anonymized data from the public health record and anonymized data from Parks and Recreation, and behind two firewalls, so information wasn't exchanged or mistakenly leaked. They were able to connect two random people, or excuse me, two of the same people using anonymized data.
Wow.
If that makes sense.
Yeah,
and so, like, if you were to say, all right, how many people in this census block are pre-diabetic and participate in the local parks and recreation programs, and in at least one, that data didn't exist before. We figured out how to make that happen. And so that's kind of a different study for a different time, one that I understand conceptually, but it's way too data oriented for me to get how it all, or the computer science behind it is something I don't understand.
Yeah.
But
well,
again, that's where I'm not a researcher. I'm the person that says this is the science and this is how it's applicable.
Yeah. Well, Jason, thank you so much for coming on the show today to at least record part one. We've got a lot of other topics. I've got notes here. We'll do a part two. But I really appreciate all the stuff that you're doing and the research you're providing, because I think this is really going to be big in parks and recreation. And I can't wait to kind of continue to dig deep and understand this message that you have. And then I want to see it implemented across the country, because it's definitely something that's of value to everybody. And really that has a kid that's in Parks and Rec for sure.
Yeah, absolutely. Absolutely. Thank you, Craig. I appreciate it. I look forward to seeing you next week. Travel safe.
Yep, we'll be there. See you in a bit. Take care, Jason. Bye.
See ya.
All right, so that was Jason Jones doing a lot of great research, also going to be speaking at NRPA. So if you're at NRPA and you'd like to learn more about what he's doing, the work the research he's putting out for Parks and Rec and health and wellness and childhood obesity, you can definitely catch him at NRPA, one of the breakout sessions. And then hopefully we'll be able to create a couple more, part 2 and part 3, to go into the work he's done. And we want to just maybe do a whole show just on F3. It's a men's workout group early morning that we both belong to that's really been impactful for our personal health and wellness. So I think we're going to do a lot of great things together, hopefully collaborating with him. So, all right, this will be the last show before we go live on Tuesday, where we have close to 40 interviews scheduled for the NRPA convention coming up in Orlando. Again, I want to shout out to all the people putting on the Orlando convention through NRPA. They are working tirelessly. I know they're probably not getting any sleep over the weekend as they prepare for this. But if you haven't been to one of the NRPA conventions, it really is a place for you to network, connect with people, learn a lot. People like Jason are going to be presenting there, and then also to connect with other professionals across America so that they can get ideas to really streamline their ramp up and their creation of something in their community by starting where some of these other communities have left off. Parks and Rec is really good about not having any best kept secrets. They really just put it out there. And if you can kind of, take what's working in another community, make it your own, you can kind of start where they left off. So that's a really big part of attending these out of state, at the national conventions. And they do the same thing at the state level. Shout out to all those associations that work at the state level. But we will be there in full force. And so if you do see us, please stop by, say hello. We still have a few slots left open for interview, but it's pretty much full. But we will see y'all there here shortly. Safe travels for everyone flying and driving into Orlando. We'll see y'all there. Again, this is Craig LeBlanc with the Daily Parks and Rec Show signing off. Y'all have an awesome weekend. See you in a bit, guys. Love y'all. Bye.
Are you a vendor, brand, or service provider ready to connect with the heartbeat of local communities? At DPRS Media Co., we tell the stories shaping parks and recreation across America. Through podcasts, live streams, videos, and newsletters, we reach frontline leaders, city directors, and decision makers every single week. From youth sports and facilities to programming and policy, our audience is your audience. Sponsoring or partnering with DPRS Media Co. puts your brand in front of the professionals who build, budget, and buy for their communities. Launching a new product? Growing your presence in public spaces? Targeting cities, counties, or departments? DPRS is your trusted media partner. Whether you're in software, turf, aquatics, robotics, smart cities, or special events, partnering with DPRS puts your brand in the story. With commercials, interviews, social campaigns, newsletters, and live shows, we're your media team. Partner with us and grow your impact in the $200 billion parks and rec industry. DPRS Media Co. Stories that move parks and rec forward. Your audience is here. Let's meet them.